All right, this is Dr. Schmidt. I would like to first kind of introduce functional neurology, kind of like what we do here and how we go about doing it. First of all, functional neurology, whenever you look at like how we test things and how we do things, it's going to be a similar exam as like a medical neurologist or any other neurologist out there, except with our exam, we're trying to change things or fix things a more healthier, natural way rather than taking medications or any major surgeries, if that is all possible. Whereas medical neurologists, they're looking at surgeries and medications as the routes to help your symptoms. So whenever we're looking at functional neurology, this would be the best cases. Classically, somebody comes in and says, hey, they've done all the imaging, the MRIs, the CT scans, everything looks normal, yet I'm still having these symptoms. That's where we come in, because that's more of a wiring issue, not necessarily that there's a tumor or something serious or a brain bleed or anything serious going on like that. That's the kind of stuff that we work with. And if you haven't had imaging done, sometimes we'll require that you get that imaging to make sure all that stuff is working well to begin with. Next is whenever we're looking at the function, it's the how you get from point A to point B that matters. It's not if you can get there. It's kind of like if I'm raising my arm, this is one way to raise my arm. Well, I didn't have any pain, that's great. But I was still able to raise my arm. And then if you go like this and then raise your arm, which one was more appropriate and accurate without causing any neck discomfort or shoulder pains? So it's all about how you do something, the optimal way of doing it that is not going to cause any problems. Similar to like if I walk across this room, if I walk with a normal gait, swinging my arms, my legs are swinging forwards and backwards really well, my gait is nice and narrow, then you have somebody whose feet are really wide and they're walking from here to that. Yes, they still got there, but they did it completely abnormal. Their legs were really wide. That's going to make their balance very unstable within a few years even. Or if someone has a limp, they're still able to get there. It's just that they were doing it wrong and inadequate, and that's what we dive into with detail to try to fix and make better for you. So hopefully that better explains the difference between functional neurology and any other neurology. And it all comes down to trying to help you get a better brain and body awareness and function. Thanks.